Now let's talk about the regional conditions in orthopedics. So what are the regional conditions? So first is frozen shoulder. So what is frozen shoulder? Frozen shoulder is seen in diabetes mellitus. It is like fibrosis in shoulder joint. So movement is restricted. Are you getting my point? This is shoulder joint, this is humerus, and this is glenoid. If there is fibrosis, if there is fibrosis in between the glenoid and humerus, so the restriction, so the movement at shoulder joint is restricted. So patient with present with restricted abduction. Okay. So how will you manage this patient? You will manage by doing physiotherapy. Okay. Physiotherapy. So this is mostly seen in patient with DM type 2. So they will form the question that patient has restricted in abduction, mostly seen in female patients. So they will present with the question will be like this: the patient has DM type 2, diabetes mellitus type 2, and he is female, and he is restricted in movement at shoulder joint. So how will you manage this patient? What is the diagnosis? So you will manage this patient by doing physiotherapy, and the diagnosis is frozen shoulder. Next is tennis elbow. What is tennis elbow? So it is patient with present with pain at lateral epicondyle. It is known as lateral epicondylitis. It is seen in tennis player. So tennis player used to play this sort. So because it is overuse of extensors, because of overuse of extensor, it developed the inflammation. Okay. So the tennis elbow, it is known as a Cozen test in done. It is Cozen test. This is Cozen test. Okay. Golfer elbow is opposite. Opposite is epicondylitis, inflammation of flexor origin. It is known as tennis elbow is tail. Tennis is epicondylitis of lateral epicondylitis. T is for lateral epicondylitis. Golfer is GM, epicondylite inflammation of flexor origin. Okay. Frozen shoulder I have explained you already. Okay. Rotator cuff I have explained you in shoulder joint, subscapularis, infraspinatus, teres minor, supraspinatus. If they got torn, it repaired by arthroscopic. Okay. Tennis elbow treatment is by steroid injection. First we will immobilize, then if did not get relief, then we put an injection in it. Okay. Now the impingement syndrome. Impingement syndrome is pain due to abduction. So it is causing impingement here. That's why it is known also. It is pain during the abduction. Subacromial bursitis. It is also known as painful arc syndrome. We will do conservative management by giving NSAID. Goal for elbow, we have discussed already pain at the epicondylite, pain at the medial epicondylitis. So because tennis elbow is the repeated injury to wrist extensors, and the goal for elbow is repeated injury to wrist flexors. Next is Dupuytren contracture. So it is the contracture like straight in hand. It is seen in alcoholic patient, seen in type 2 DM. Start with ring finger. Okay, it has 3 stages. Nodular stage, fibrosis stage. Okay. So how will you manage vegetation? But first we will do physiotherapy. These all are the regional condition. Okay. So gamekeeper's thumb is avulsion in UCL, ulnar collateral ligament. Okay, this is the ulnar collateral ligament. Next is ganglion cyst. It is mostly it form in the hand. It is a unilocular cyst containing the mucinous fluid. Baker cyst is popliteal cyst, same like ganglion cyst. Haglund deformity is retrocalcaneal bursitis. This is retrocalcaneal bursitis is Haglund deformity. Hallux valgus is the deviation. This is hallux valgus. This is foot. So you can see this is medially deviated. Okay, this is hallux valgus. Gout. It is the due to increase in uric acid, it causes inflammation at first MTP joint. We have learned about the anti-gout drugs in pharmacology. Decurrent tenosynovitis. So decurrent tenosynovitis is painful inflammation at the APL and EBP tendon. So it is APL. So decurrent tenosynovitis, it is painful inflammatory condition caused by the tendons on the side of wrist. So these are the first compartment. First compartment tendons are APL and EBP. APL is abductor pollicis longus. EBP is extensor pollicis brevis. These both tendons are affected. It is due to chronic overuse activities such as playing piano, fishing, carpentry activities by office worker. Treatment, we will give conservative treatment first, then immobilize. A cough test is done. It is thumb kept in palm and fist is closed in neutral position, and then deviate the ulnar, leads to severe pain. This is Eckhoff test. Okay. Finkelstein test. It is also used in recurrent tenosynovitis. Okay, so I did not put the image of Eckhoff test and recurrent tenosynovitis and Finkelstein test. Okay. So trigger finger. What is trigger finger? Stenotic tenosynovitis of A1 pulley. So patient will say that my finger goes like this. This is trigger finger. Mallet finger, hyperflexion injury, avulsion of extensor tendon. Because it is causing hyperflexion injury, so the extensor tendon will avulse. So it is MAF, hyperflexion injury. Jersey क्या है? Opposite है hyperextension injury. It is avulsion of FDF. It is like this. Jersey is like this. It is going in extension. Housemaid knee. So the worker in your house used to पोंछा लगाती हैं वो बैठ के. So that leads to prepatellar bursitis. Clergyman knee. Housemaid knee is this. Clergyman is this. So clergyman फादर होते हैं जो उसमें चर्च में जो पढ़ते हैं, तो दैट कॉजेज द इन्फ्रापटेलर बर्साइटिस. स्टूडेंट एल्बो, स्टूडेंट ऐसे पढ़ते हैं तो दिस कॉजेज द ओलिकनॉन बर्साइटिस. टेलर्स एंकल, टेलर जो चलाते हैं वो सिलाई करते हैं, तो दैट कॉजेज द फिफ्थ मेटाटार्सल, अफेक्टेड द फिफ्थ मेटाटार्सल. ओके, so let's recall all the regional conditions. So frozen shoulder, so we have understood that it is due to frozen shoulder is due to it is also known as adhesive capsulitis, most commonly seen in female. It is seen in DM type 2. Tennis elbow is lateral epicondylitis. Tail golfer is just opposite, medial epicondylitis. Rotator cuff, we have learned about all the four muscles repaired arthroscopically. Cosen test is done for tennis elbow. And Dupuytren contracture is seen in alcoholic and diabetes mellitus patient. Start with ring finger. It has 3 stages: nodular and fibrosis stage. Treatment by physiotherapy. Goal gamekeeper's thumb is avulsion of UCL, ulnar collateral ligament. Okay. Ganglion cyst is a unilocular cyst. Baker cyst is popliteal cyst. Hegler deformity, retrocalcaneal bursitis. Hallux valgus, I have explained to you already. Gout is inflammation of first MTP joint due to increase in uric acid. And recurrent tenosynovitis में दो जो इसके टेंडन है वो पूछे जाते हैं. फर्स्ट इज एपीएल, सेकंड इज ईवीपी. एपीएल इज एबडक्टर पॉलिसिस लॉन्गस, ईवीपी इज एक्सटेंसर पॉलिसिस ब्रेविस. नाउ Finkelstein test, it is used in recurrent tenosynovitis. Trigger finger, tenosynovitis of A1 pulley. Mallet finger, it is hyperflexion, MAF. Jersey is hyperextension injury, it is avulsion of FDP. Housemaid knee is prepatellar bursitis. Clergyman knee, I have explained to you, infrapatellar. Student elbow is olecranon bursitis. Tailor's ankle is fifth metatarsal. Okay, so this is the end of regional condition of ortho.